We did a study to see if menopausal hormone therapy was associated with GI bleed, and the data from our study showed that it indeed is associated with GI bleed, specifically the lower gastrointestinal bleeding, and most of these bleeding were coming from an entity called ischemic colitis, in which the blood supply to the large intestine gets decreased and because of a clot or a thrombus, and therefore the bleeding occurs. So we did know that menopausal hormone therapy is associated with numerous clotting diseases such as clots in the legs, clots in the lungs, and so on. But whether it was associated with bleeding or not, it was not very clear. There were very small studies in terms of just 100 sample size, which were case control and retrospective in module, which suggested that there might be a link, but there were no prospective studies in such large numbers. So we decided to look into it using a prospective data set. We took the patients who were currently on menopausal hormone therapy and the patients who were using it in the past and those who had never used it. And those who were currently using it were at increased risk of having GI bleeding, specifically the lower gastrointestinal bleeding in the form of ischemic colitis. Menopausal hormone therapy is indeed an effective treatment for the symptoms it is used for, which come the symptoms from menopause. But it comes with its own cost. We knew that it has its own side effects in the form of stroke, MI, and clots in the lungs and clots in the legs. But indeed, now we are finding that there is also a bleeding propensity. That also is probably because it increases the tendency to form clots. And when it clots off a blood vessel which supplies blood to the intestine kind of dies and loses blood. So it is something which you need to discuss with your PIT provider, that what are the risks and what are the benefits of menopausal hormone therapy, and it should be prescribed not as a light therapy but only when benefits outweigh the risks. I think it makes sense that patients who have had ischemic colitis in the past should not go on it, because they already had that kind of entity in the past. So there is already some vessel abnormality there, and if they go on it, there can be increased risk. And this was not studied in our study, this is just my hypothesis, but the thing which we did look at is that the duration of menopausal hormone therapy was linearly associated with the risk of GI bleeding. So the longer you stay on it, the increased is the risk of you having a GI bleed. So I think it makes sense that at every stop point you should ask yourself whether I still need this therapy or can I come off it. I think it does indicate that it is a new finding in the way that this is completely new and innovative. So this is something to be discussed with your providers, and the providers should also discuss this with their patients, because the patient might still not know that this is the risk they're entitling to, and the provider should always mention it and then discuss with the patient, because nowadays a lot depends on what patient wants and what they decide to go for in terms of their therapy.